Okay, so you're prepping for a physician interview.
Hmm.
First of all, congrats on getting to this stage.
Yeah,
Landing an interview is a huge accomplishment in itself.
it is.
We're going to dive deep into some expert advice today from an article called 30 Physician Interview Questions and Expert Answers.
Okay.
Think of this as your secret weapon for navigating this crucial step.
I like it.
All right, so
Yeah.
it's true that acing med school exams and rotations is one thing,
Right.
but presenting yourself as a skilled and compassionate physician in an interview,
Yeah.
it's a whole other challenge altogether.
It's true that acing med school exams and rotations is one thing, but presenting yourself as a skilled and compassionate physician in an interview is another challenge altogether.
Yeah, so that's where this deep dive comes in.
Okay.
We're not just going to summarize the article.
Yeah.
We're going to extract the golden nuggets of wisdom that can really make you stand out.
Hell of it.
And trust me, there's a surprising connection between hockey small-town life and becoming a great doctor. That we'll uncover along the way.
Interesting.
So preparation is absolutely key.
Absolutely.
This isn't about memorizing answers.
Right.
It's about understanding how to showcase your unique qualities and experiences.
Definitely. And the article really stresses moving away from robotic rehearsed responses.
Yeah.
Instead, it encourages us to think about structuring our answers around key points.
Yeah.
It's like building a mental framework that you can adapt to different questions.
That's a great point.
Yeah,
And it's not just about what you say, but how you say it.
for sure.
Speaking of storytelling, the article has a fantastic example of how to answer, "Tell me about yourself."
Okay.
And it starts with a vivid picture of a small town in Manitoba, Canada, where it's so cold the average temperature is -10 degrees Celsius.
Wow, that's cold.
I know.
Yeah, and what's interesting is how the sample answer connects the speaker's brother's hockey career to their own path to medicine through sports medicine.
It's unexpected, right?
It is.
It makes you lean in and want to hear more. They've managed to make something as simple as "Tell me about yourself" genuinely interesting.
Exactly. It showcases the importance of finding those unique details that reveal your personality and make you memorable.
Now, let's face it, some interview questions can feel like curveballs
Yeah,
designed to put you on the spot.
sure.
Like, how do you handle a patient who challenges your professional opinion with information they found online?
Ooh, that's a really relevant question in today's world where patients have access to so much medical information online.
Yeah.
The article presents a scenario where a patient insists on a treatment plan found online, even though it contradicts the doctor's advice.
Talk about a delicate situation.
It is.
It's like you need to be a medical detective and a diplomat all at the same time.
Okay.
So how does the expert suggest handling this?
Well, the sample answer emphasizes the importance of staying calm, actively listening to the patient's concerns, and clearly explaining the rationale behind your medical decisions.
Right.
It's about building trust and understanding, not dismissing the patient's perspective.
I think what resonates with me here is that it's not about being right or wrong. It's about finding a way to connect with the patient and help them understand your recommendations.
Absolutely.
It highlights the importance of patient-centered care even when it's challenging.
Absolutely. And it reminds us that effective communication is a crucial skill for any physician.
Another question that can be tricky is, why do you want to work with us?
Oh, yeah.
It's easy to fall into generic responses,
Right.
but the article highlights the importance of tailoring your answer to the specific institution.
Yes. And the sample answer in the article does a fantastic job of this.
Yeah.
It praises the hospital's vision and then focuses on specific features like a free clinic that genuinely resonate with the candidate's values. It feels sincere and well-researched.
That's such a great point.
Yeah.
Doing your homework and showing genuine interest in the specific institution can really set you apart from other candidates.
Absolutely.
It's about showing that you're not just looking for any job, you're looking for the right fit.
And it demonstrates that you're proactive and take initiative qualities that are highly valued in any profession, especially medicine.
Now let's dive into a classic question.
Okay.
What are your greatest strengths?
Right.
The example provided focuses on self-discipline,
Okay.
but it doesn't stop there.
Right.
It backs it up with a compelling personal story about adhering to a strict schedule.
I love how they don't just state the strength, but actually bring it to life with a specific anecdote.
It's much more impactful than just saying, "I'm organized."
Yeah,
It paints a picture of someone who is truly dedicated and disciplined.
absolutely.
And speaking of real-life challenges, let's talk about that dreaded question.
Okay.
How do you handle stressful, pressure-filled situations?
Oh, yeah.
I think we can all relate to that one, right?
Oh, absolutely.
Yeah.
Everyone experiences stress.
Yeah.
But it's especially important for physicians to be able to manage it effectively.
The article uses a relatable story about forgetting a crucial quiz and panicking.
Oh, no.
But the real takeaway is that panicking hinders problem solving.
That's a crucial insight. The sample answer emphasizes that remaining calm and solution-oriented is essential, especially when the stakes are high.
And as a physician, the stakes are almost always high.
Right.
You need to be able to think clearly and make sound decisions under pressure.
Exactly.
Yeah.
It's true, medicine requires a unique combination of knowledge, skill, and resilience.
Right.
And that brings us to another critical area highlighted in the article, understanding the specific demands of a physician's role.
Right. It's not just about medical expertise.
Right.
It's about navigating complex interpersonal dynamics, often under intense pressure.
Mm.
And one question that really gets at this is, how much time do you spend with each patient?
Okay.
Seems straightforward,
All right.
but there's a subtle art to answering it effectively.
Yeah, what's fascinating about the sample answer is that it avoids giving a specific number.
Okay.
Instead, it emphasizes a commitment to providing thorough care while being mindful of time constraints and other patients waiting.
Right.
It's a delicate balancing act.
It's like saying, I'm dedicated to each patient's individual needs, but I'm also aware of the bigger picture and the need to be efficient.
Right.
It highlights that you're a patient advocate and a team player.
Yeah.
And speaking of teamwork, the article also tackles the question, what do you think the nursing and ancillary support staff would say about you?
Oh, that's a good one.
This question is all about demonstrating your ability to collaborate effectively with the entire healthcare team.
Mm-hmm.
Recognizing that excellent patient care is a collaborative effort is crucial.
Absolutely. It's
Yeah.
about showing that you value and respect everyone's contributions,
Yeah.
from the nurses to the technicians to the administrative staff.
We're all in this together, working towards the same goal.
And remember, the interviewer might actually reach out to these individuals for feedback. So
Yeah.
honesty and genuine reflection are key here.
Authenticity is so important.
So important.
Don't try to oversell yourself or pretend to be someone you're not.
Right.
Now let's address a question that can feel like a trap.
Okay.
What is your biggest weakness?
The classic weakness question.
Right.
It's a chance to show self-awareness and a commitment to growth.
So avoid cliches like, I'm a perfectionist or I work too hard.
Right.
Interviewers see right through those.
They do. I appreciate that the article doesn't provide a specific example for this question.
Yeah.
It encourages introspection and coming up with an answer unique to your experiences.
And that leads us to another question that requires careful thought.
Okay.
Have you ever made a misdiagnosis?
Yeah.
If yes, how did you resolve it?
Tough one.
This can be tough because no one wants to admit to mistakes, especially in medicine where the stakes are so high.
Of course, honesty and transparency are crucial here.
Right.
While acknowledging the mistake, you can also highlight your professionalism and commitment to learning from the experience.
It's about focusing on the steps you took to rectify the situation and what you learned from it, demonstrating accountability and a growth mindset.
Interviewers understand that everyone makes mistakes.
Yeah.
What matters is how you handle them
Oh,
and
yeah.
what you learn from them.
Now let's shift gears to a question that touches on potential conflicts.
Okay.
Have you ever had to conform to a policy with which you disagreed? How did you handle it? This one can be tricky because it involves navigating complex organizational structures and potentially challenging situations.
Yeah, the key here is to strike a balance between advocating for what you believe is right
Right.
and respecting established procedures.
So avoid ranting about bureaucracy or claiming to always know best.
Right.
Instead, describe a situation where you disagreed with the policy calmly and respectfully, explain your reasoning, and outline the steps you took to address your concerns through the appropriate channels.
It's about showcasing maturity, professionalism, and a commitment to finding solutions that benefit everyone involved.
Now let's dive into a question that's all about patient communication.
Okay.
What is your process for presenting complicated information to patients?
This is where your empathy and communication skills truly shine. It's about conveying complex medical information clearly, concisely, and understandably, especially when patients might be feeling anxious or overwhelmed.
It's about meeting them where they are using language they can grasp and checking for understanding along the way.
While the article doesn't provide a specific example for this question, it emphasizes the importance of tailoring your communication style to each patient's individual needs and level of understanding.
What works for one patient might not work for another. Adaptability and responsiveness are key.
For sure.
And let's not forget about the equally challenging task of presenting unpleasant news to patients.
Right. This is one of the most difficult aspects of being a physician,
Yeah.
requiring medical expertise, empathy, and sensitivity.
The article doesn't shy away from this tough topic.
No?
It stresses the importance of delivering difficult news with honesty, compassion, and clear communication.
Providing support and guidance to patients and their families during challenging times.
Yeah.
It's about being a true healer in every sense of the word.
And that brings us to a question that might seem like a no-brainer, but it's worth considering carefully. What makes you think you are a good physician?
Oh, interesting.
It's easy to fall into the trap of listing accomplishments, but the article encourages a deeper reflection on what truly defines a good doctor.
Yeah, this question is an opportunity to showcase your values, your passion for medicine, and your understanding of what it means to provide excellent patient care.
It's about going beyond technical skills and highlighting the qualities that make you a compassionate and dedicated physician.
Absolutely.
Now let's shift gears to a question that focuses on professional development.
Okay.
How do you keep up with changes in medicine and healthcare trends?
This is where you demonstrate your commitment to lifelong learning and your ability to stay current in a field that's constantly evolving.
It's about being intellectually curious, seeking out new knowledge, and embracing innovation.
The article doesn't give a specific answer, but it implies that interviewers are looking for evidence of active engagement in professional development.
This could include attending conferences, reading medical journals, participating in online forums, or pursuing additional certifications.
It's about showing that you're not content with the status quo. You're constantly striving to improve your knowledge and skills to provide the best possible care.
Now let's talk about a question that can be a bit tricky.
Right.
What aspects of practicing medicine do you find most challenging? Why?
Hmm.
You don't want to sound like you're complaining or not cut out for the job.
No, this question allows you to demonstrate self-awareness and your ability to identify and address areas for growth.
So don't shy away from the challenges.
Right.
Instead, choose a challenge that is genuine and discuss how you've worked to overcome it.
It could be dealing with difficult patients, managing complex cases, or staying up to date with rapidly evolving medical knowledge.
What matters is that you demonstrate a willingness to learn and a commitment to continuous improvement.
And to balance that out, let's consider the flip side.
Okay.
What aspects of practicing medicine do you enjoy the most and why?
This is your chance to let your passion shine through.
Yes. This is where you can talk about what truly inspires you about medicine, sharing your enthusiasm, and highlighting the aspects that bring you joy and fulfillment.
It could be the intellectual stimulation of solving complex medical puzzles, the satisfaction of helping patients regain their health, or the deep human connection that comes with caring for others.
It's about showcasing the heart and soul of what makes you a compassionate and dedicated physician.
Okay, this next one really gets to the heart of your values.
Okay.
What characteristics are important for healthcare professionals to possess, in your opinion?
This question lets you demonstrate your understanding of the core values underpinning the medical profession. It's about highlighting the qualities you believe are essential for ethical, compassionate, and effective patient care.
Things like empathy, integrity, communication skills, teamwork resilience, a commitment to lifelong learning, and a deep respect for patients and colleagues.
Exactly. It's about showcasing your understanding of the multifaceted nature of being a physician and the importance of embodying these values in all aspects of your work.
And here's a question that goes beyond clinical skills.
No?
What do you do to promote a healthy balance between work and your personal life?
This question is about demonstrating self-awareness and your ability to manage the demanding nature of a physician's career while maintaining a fulfilling personal life.
It's about showing that you understand the importance of setting boundaries, prioritizing self-care, and nurturing your relationships outside of work.
The article doesn't provide a specific answer for this, but it emphasizes the importance of finding strategies that work for you.
This could include activities like exercise, spending time with loved ones, pursuing hobbies, or simply taking time to relax and recharge.
It's about showing that you're not just a dedicated physician, but also a well-rounded individual who values their well-being and personal life.
That balance is so important for long-term success and fulfillment.
Absolutely.
Now let's tackle a question that often comes up in interviews. Why should we hire you?
This is your chance to sum up your qualifications and convince the interviewer that you are the best candidate for the job.
It's about reiterating your key strengths, highlighting your unique experiences, and expressing your enthusiasm for the opportunity.
The article doesn't provide a specific answer for this question, as it should be tailored to your individual qualifications and the specific requirements of the position.
But it does emphasize the importance of being confident, articulate, and persuasive in your response.
It's about leaving the interviewer with a lasting impression of your skills, your passion, and your commitment to being an exceptional physician.
Okay, let's move on to another thought-provoking question.
Okay.
What would your references say about you?
This is your chance to showcase the positive feedback you've received from others who have worked closely with you.
It's about highlighting the qualities that make you a valuable colleague and a respected member of the healthcare team.
Choose references who can speak to your strengths, your work ethic, and your ability to collaborate effectively.
And don't forget to reach out to your references beforehand to let them know you've listed them and give them a heads up about the position you're interviewing for.
That's a great point. It ensures they're prepared to provide positive and relevant feedback.
Now let's move on to a question that focuses on your technology skills.
Okay.
Do you have any experience using electronic medical records on the job?
This is a crucial question in today's digital healthcare landscape.
Right.
Electronic medical records, EMRs, are integral to modern practice, and interviewers want to know you're comfortable using them.
Be honest about your experience level. If you're proficient in a specific EMR system, highlight that.
Right.
And if you have limited experience, emphasize your willingness to learn and your ability to adapt to new technologies quickly.
It's all about showing that you're tech-savvy and adaptable, which are essential qualities in today's rapidly evolving healthcare environment.
Here's a question that encourages critical thinking about the healthcare system.
All right.
What challenges do you feel physicians face today?
This question allows you to demonstrate your awareness of the broader issues affecting the medical profession and your ability to think critically about potential solutions.
Don't shy away from the challenges. Instead, choose a few key issues that resonate with you and discuss them thoughtfully.
It could be the increasing administrative burden on physicians, the rising cost of healthcare, the challenges of providing care to an aging population, or the ethical dilemmas posed by advancements in medical technology.
What matters is that you demonstrate your understanding of the complexities of the healthcare system and your ability to think critically about the challenges facing physicians today.
This question shows that you're not just focused on your own individual practice, but also concerned with the larger issues affecting the profession and the patients you serve.
And finally, let's end with a question that invites reflection on your personal and professional journey.
Okay.
Where do you see yourself in 10 years?
This question is about showcasing your ambition, your long-term goals, and your vision for your future as a physician.
It's about demonstrating that you're not just looking for a job, but a career path that aligns with your passions and your aspirations.
Be honest and realistic in your response.
It's okay to express your desire for career advancement or to pursue specialized training in a particular area of medicine.
What matters is that you convey your enthusiasm for your chosen field and your commitment to making a lasting contribution to the medical profession.
This question is an opportunity to leave the interviewer with a sense of your drive, your vision, and your dedication to becoming an exceptional physician.
It's a chance to showcase your ambition and your commitment to professional growth, which are highly desirable qualities in any candidate.
Now, before we wrap up this deep dive, let's revisit one last question that can make or break your interview.
Okay.
Do you have any questions for me?
This seemingly simple question is actually one of the most important parts of the interview.
It's your chance to demonstrate your genuine interest in the position, your engagement with the interviewer, and your initiative in seeking further information.
Don't waste this opportunity by saying you don't have any questions, or by asking generic questions that could be easily answered with a quick Google search.
Instead, prepare thoughtful questions that demonstrate your research into the institution, the specific role, or the interviewer's own experiences.
For example, you could ask about the hospital's culture, the team dynamics, the opportunities for professional development, the challenges of the position, or the interviewer's own career path within the institution.
Asking insightful questions not only provides you with valuable information, but also leaves a positive impression on the interviewer.
It shows that you're curious, engaged, and genuinely interested in the opportunity.
Remember, the interview is a two-way street. It's not just about them evaluating you, it's also about you evaluating them to determine if this is the right fit for your career goals and your personal values.
Asking thoughtful questions is a powerful way to gather information, build rapport, and demonstrate your initiative.
So as you prepare for your physician interview, remember that it's not just about answering their questions, but also about asking your own.
By engaging in a meaningful dialogue, you can gain valuable insights and leave a lasting impression as a thoughtful, engaged, and highly motivated candidate.
Wow, we've really covered a lot of ground in this deep dive into physician interviews.
Well, yeah.
From crafting compelling narratives to handling those tricky questions, it's clear that thorough preparation is key.
It is.
But what stands out to you as the most important takeaway from all of this?
You know what's fascinating to me is that it all boils down to authenticity.
Yeah.
It's not just about reciting textbook answers.
Right.
It's about showcasing your genuine passion for medicine, your unique experiences, and the qualities that make you well you.
I totally agree.
Yeah.
In a way, it's like that unexpected connection we talked about earlier, the
Right.
one between small-town life hockey and becoming a great doctor.
Mm.
It's about finding those personal details that make you stand out and create a lasting impression.
Exactly. The interviewers are not just looking for someone who knows the right answers. They're looking for someone who will be a valuable addition to their team, someone who will connect with patients and colleagues on a human level.
It's almost like the interview itself is a microcosm of what it means to be a great physician.
Yeah.
It's about communication, empathy, problem solving, and that ability to stay calm under pressure.
That's a brilliant insight, and it brings us back to that final thought from the article.
Yeah.
The idea that the interview is not just about answering questions.
Yeah.
It's about showcasing the unique and compassionate physician you are.
So for all you future doctors out there, as you prep for your interviews, remember this.
Mm-hmm.
Let your personality shine through, share your passion, and don't be afraid to be yourself.
Yeah.
Because ultimately, that's what will make you a truly exceptional physician.